the party master on Up and Go, The Bridge, 99 FM.
So it's now 3 minutes after the hour of 6 o'clock. My name is Richie B. Thank you for joining us here on The Bridge. It is Up and Go, that's the name of the show. And we go all the way until 10 o'clock this morning. And we have some really wonderful guests lined up. We have some great music and some fun features that will keep you quite happy throughout the morning. We're here to get you up, to get you dressed, get you fed, and get you out to work, school, or play. Good morning and welcome to Up and Go today. Time now for us to take a look at headlines across the bridge here on The Bridge 99 FM to the world. And we start with a headline from the Jamaica Gleaner. DRMA fight. Court battle launched on the constitutionality of the law as COVID-19 weapon. Buffeted by criticism of the flagship legislation used to contain the coronavirus outbreak, the Holness administration will face an acid test when the first constitutional challenge against the DRMA is to be mentioned in the Supreme Court on November 1. Firebrand clergyman, the Reverend Jeffrey Shuttleworth of Freedom Come International Ministry, is challenging the constitutionality of the 2015 Act, which he says he's contending trespasses on religious freedoms guaranteed by the Constitution. The Jamaican government since last March has employed the use of the DRMA as the primary legislative tool to manage and contain the pandemic. However, there has since been growing unease about what some critics say is the oppressive nature of the law, with more and more Jamaicans questioning and contemplating challenging the constitutionality of the act. St. Anne brothers Justine and Javon Callum, who were recently fined $25,000 in the St. Anne Parish Court for breaching the curfew and not wearing masks, have indicated that they are contemplating filing a constitutional claim. The brothers are maintaining that they were in Brownstown Square awaiting transportation when they were arrested. But President of the United Independence Congress, Joseph Patterson, and 3 other persons who were recently charged with breaching the DRMA following an alleged unauthorized march last month have indicated that they too will be challenging the constitutionality of their arrest under the Act. From the Observer, we have immigrant advocacy groups double down on pathway to citizenship for Caribbean nationals. Immigrant advocacy groups in New York have increased pressure on United States Senate Majority Leader Chuck Schumer to deliver on citizenship for Caribbean and other nationals in the U.S. federal budget reconciliation package. In front of Senator Schumer's Manhattan, New York office, immigrant advocates and community members urged the Majority Leader to ignore the faulty assessment offered by the parliamentarian and fulfill the promise that Democrats made to immigrant communities, according to the New York Immigration Coalition, NYIC, an umbrella policy and advocacy organization of more than 200 groups in the New York state. It said that the historic budget package would help create a pathway to citizenship for some over 463,000 immigrant New Yorkers while boosting the U.S. economy. And further in the region, reform is the only way forward, world leaders and a Nobel laureate said at the first ministerial roundtable discussion on UNCTAD's 15th quadrennial conference recently. Barbados' Prime Minister Mia Mottley gave her report from the front lines as a nation at the intersection of debt and climate vulnerability. She said the international economic system faces its biggest task since the establishment of the Bretton Woods institutions because of the front line of trade dependency crossing the front line of the climate crisis. The rise in developing country total debt, public, private, domestic, and external, is at its highest level on record, at 193% of combined developing country GDP in 2018. Motley called on those attending UNCTAD's 15th summit to come together to rescue the international system and create a new trade agenda that works for the whole world, which includes revisioning of the debt and trade systems. And we have enough time to give you one more story. U.S. and Mexico set to negotiate on that should be updated bilateral security arrangement to address concerns on both sides. Secretary of State Anthony Blinken, Attorney General Merrick Garland, and Homeland Security Secretary Alejandro Mayorkas will meet with their Mexican counterparts today in Mexico to discuss a new security arrangement called the U.S.-Mexico Bicentennial Framework for Security, Public Health, and Safe Communities. The United States and Mexico recognize the need to adopt bilateral security cooperation to address the concerns and priorities of both governments, the official told reporters. Our security challenges are shared, and so is the responsibility of resolving them. The new agreement will update or possibly replace the $3 billion Merida Initiative, a 2008 pact meant to fight drug trafficking and organized crime. All right, that brings our time now to 20 minutes after the hour of 6 o'clock, and that was Headlines Across the Bridge. You heard about the two brothers who were talking recently, and one of them said, my wife is an angel. Well, the second man says, you're lucky. Mine is still alive. OMG. There are always these wives jokes, man, and they're provided to me, and I share them when I get them. All right. Now, there are also some teacher jokes that are quite funny. For instance, here's one. Why did the teacher marry the janitor, you might ask? Well, the answer is simple. Think about it. Why did the teacher marry the janitor? Well, the answer is simple, I said. Because he swept her off her feet. Yeah, in one go, him sweep her off her feet. Wedding ring shortly thereafter. Okay. This one is easy. What's the difference between a general practitioner and a specialist? Well, one treats what you have, and the other thinks you have what he treats. Who says hair to that? Hair? Okay. Now, imagine you're the boss at your business place and you're doing an interview and you're getting the same answer for every question that you ask. In this instance, the one answer that remained constant from the person being interviewed is MP, sir. MP, sir. If you don't believe me, listen to this.
What is your name?
MP, sir.
In full, please.
Muzapiri.
Your father's name?
MP, sir.
What does that mean?
Melvin Piri.
Your native place?
MP, sir.
What is that?
Mpumalanga province.
What is your qualification?
MP.
What is that?
Mathematics professor.
So, why do you need a job?
It is because of MP.
Meaning?
Money problems.
Would you explain yourself and stop wasting my time? What's your personality like?
MP, sir.
And what is that?
Marvelous personality.
I see. I will get back to you.
How was my MP, sir?
And what's that again?
My performance.
I think you have an MP, sir.
Meaning?
Mental problem.
You do have a mental problem. That is your MP. Get out of my office. Be on your way. Right about now, we'd like to welcome to the program the president of the Jamaica Medical Doctors Association. We're talking to Dr. Mindi Fitz Henley. Good morning, Doc. How are you today?
Good morning. Thanks for having me.
Wonderful to have you as per usual. I have to start by asking you, Doc, how have you and members of your profession and those within your organization, association, been coping with the pressures being brought on by COVID-19 at this time?
I mean, for us, there's a level of exhaustion that didn't exist before. It's been a continuous cycle from last year. And even though there may be some times that we wane for a bit, it's coming right back up. So, once you get a little dip where we know what's about to happen. And so it's been a wild ride. We continue to push as hard as we can and to do as much as we can to try and save patients, which is our ultimate goal. But everybody's exhausted at this point.
Mm-hmm. We always like to do it, and we're going to do it again today, which is to thank you and the members of your profession for being out there on the front line and for the hard work that you're putting in. We appreciate it, and we thank you.
Thank you so much.
Wonderful. Now, Doc, we know that there have been a few cases of nurses who are affected by the COVID-19 virus. To the best of my knowledge, your association didn't have much in terms of doctors being affected.
In terms of actually contracting COVID, yes,
yes.
we've definitely had. Yes, we've had quite a few
Really?
doctors that have contracted COVID. You see, what's happening for us, remember, all of healthcare workers will have an increased risk because of the amount of time that we spend with COVID patients. Not to mention persons who come in with unrelated symptoms who end up having COVID as well. And so all of our risk would be quite high. It's very traumatic and very sad that the Nurses Association has lost quite a few colleagues. And so when we see that happening, these are also people we work with on a daily basis, right. Persons side by side with us. And so it's very sad for us as well when this happens, because it also makes it real that it could happen to us as well.
Yeah. So you have had doctors who have contracted, but not many that I can recall have actually died as a result.
Right. That has been the difference.
Okay. Got you. All right. And we hope that going forward that none of your members will actually contract the virus. Doc, I found it quite surprising to learn that most of our doctors here in Jamaica were on contract. What happened to those who were laid off in the pandemic? What's the latest on that?
Well, what has happened there is, as you know, the ministry needed mobile vaccination team members. And so we were able to get some persons employed through that, short term, of course. We also were able to get some persons for the private sector vaccination team. So some persons were there. And then some of the blitz exercises, we've also had persons engaged in that area. So although there were some short-term contracts or employment, at this point we were trying to get as many members back into the system as possible. The thing to remember is the issue before was that they were using employment contracts that had expired before and trying to use that same 6 months that was approved and continue it. The ministry, is allowed to offer short-term contracts once it is that the doctor themselves have asked for the contract to be shorter, whether there is an issue with performance or whether it is recommended by the senior medical officer of the hospital as well as the CMO. And so once those three things are fulfilled, then short-term contracts are legal. The issue before was that none of those three things were a condition.
So as it is now, as at today, the industrial relations situation between the ministry and your association is at a much better place, would you say?
Definitely at a much better place. However, this is not something that we enjoy. We don't like the fact that we have members on short-term contracts, but, we understand that with a surge like this, there has to be some increase in employment. The aim, however, which they have communicated with us, is that after persons have these short-term contracts, whether it's 6 months or 1 year, that they're going to try and engage them into the system full-time. So some of the persons who had initial 6-month contracts were actually converted to 2-year and 3-year contracts, which we're very grateful for. It was sad that it had to go through that, lengthy and public situation before. That's not something that we like.
Right.
But we're grateful for the outcome that we had in that situation. Okay. We're just hoping it never gets to that point again.
Okay, yes, we certainly do. Now, as it relates to mandatory vaccination, we know that there are a number of persons who are still hesitant, and there's more and more talk about mandatory vaccination. Do you think that this call for mandatory vaccination will sort of change the mind of those who are already concerned about taking the vaccine? What are you seeing as the outcome?
Well, what I think is important to remember is that some persons who are vaccine hesitant truly just want information. Luckily, I believe it's 2 nights ago, myself and Dr. Brian James, who is the current president of the Medical Association of Jamaica, we had about a 2-hour meeting with the ministry vaccination task force. So what we did at that point in time, we laid it bare. We discussed some issues that we had noticed in the system and things how we can fix it. And so I think we had a very good meeting. We were able to engage directly and to just find solutions on the ground. And so I think it's very, very important that we try and separate the two sets of persons. One area will be those who are completely against vaccination, whether it's because of false information, whether it's because of religious reasons, or just completely being against vaccines. Those persons, however, may change their mind when it comes to U.S. visa, Canadian visa, UK visa, etc. But there are those who just want information, but because they're regular doctors or they're clinic doctors, they can't necessarily go to clinic and ask for an appointment just to get information about their vaccines. And so it's important that we can reach these persons on the ground where they're at and give them the information, because it's not uncommon for us, any of the doctors, to interact with a few of these persons, and they want their vaccine immediately. All they wanted was somebody they could trust and discuss the issues with and their questions. And I think that is where we need to beef up and to strengthen that area so we can get these persons the information that they want, answer their questions. Because some persons just want to know if it's possible for them to be vaccinated if they have high blood pressure, if they have diabetes, if they have a heart condition, if they have an autoimmune disorder, and once we can answer these questions for them, we can definitely reach a far way and increase the number of persons being vaccinated. Another big thing, which I've spoken about multiple times before, is increasing those site hours. We need to increase the health center take up. A lot of persons don't know that vaccinations are being offered at health centers. And so when we can keep the vaccines in the area where persons don't have to be taking one or two taxis or, going on buses for 45 minutes, crossing parish lines or community lines, we will definitely see an increase. So we need to go back to our primary care model that we are known for. We have a very strong immunization record in Jamaica. We need to use what already exists, get back into the health center, reach persons in their community, and increase the site hours, because persons are still at work at 3 p.m. And so we have to have sites that are available to persons once they've left work. Most persons don't have the privilege or ability to be able to get 4 hours off of work to try and get it to a vaccination site. So we have to come to the people now.
It was in July of this year, I think it was, that you spoke about another era of hesitancy, Dr. Fitz Henley, and that had to do with junior doctors who you said at the time were hesitant now about pursuing a career as a doctor in light of what was going on. Would you say that sentiment has somewhat changed since?
I think yes and no. For some persons, depending on where they're working, because of the level of exhaustion and burnout that they've reached, they may not see a way out. But I think as we can increase the compassion, once we can increase and improve the hours that they're working, as well as the conditions that they're working in, I think we're seeing more of a turn. It's just a level of exhaustion, lack of sleep, not being able to interact with family members at the time, not being able to get any time off. Persons were just buckling under pressure. And so we have to do something about the working conditions that we have our doctors in as well.
All right. And finally, then, what is your hope for the doctors, the medical staff, in light of all that is happening? Any ideas to share?
Yes, I'm hoping that more persons can come out and get vaccinated. If you see your clinic doctor, your community doctor, ask the questions that you have. I have no issue if you see me on the road somewhere to stop and ask me questions. I do it quite regularly. We need to get more persons vaccinated. That's the only thing we can do to decrease the burden that we're having on the medical professionals, whether it's the doctors, the nurses, the physiotherapists, the porters, everybody. That's the only way we can do it, so we can lessen the burden on the system. We're able to go back to taking care of all of our chronic disease patients who are also afraid to come to clinic now of contracting COVID. We need to decrease the burden at the hospitals. We need to ensure that we have enough staff to be able to take care of the babies that are coming in, the pregnant mummies, the non-COVID related diseases and illnesses. We have to get back to a level of normalcy, and the only way to do that is to get persons to come out, get vaccinated, ensure they're wearing their mask appropriately. And we need to get our children back in school.
Mm-hmm. Yeah. We heard you loud and clear, and we thank you as always for talking with us, Dr. Mindi Fitz Henley. I wish you a wonderful day and a wonderful weekend. Take good care.
Thank you. Same to you.
All right. Appreciate that. She's the president of the Jamaica Medical Doctors Association. That was a chat with Dr. Mindi Fitz Henley. It's a Friday morning, the start of the weekend, and we're making it happen big time in prime time right here on Up and Go with Richie B. And recently, you would have heard, by way of a release that we all would have seen, that the PSOJ and the JMEA jointly are calling for mandatory vaccination. We're joined at this time by the Executive Director of the Private Sector Organization of Jamaica, Imega Breese McNab, who's our guest on the telephone. Good morning, Miss Breese McNab. How are you today?
Good morning, Richie B. I am well, thanks. Have life and good health.
Yes, that's a lot to be thankful for.
Yes.
And wonderful to have you at this early hour. I want to ask you, Imega, with the recent call for strict measures to be taken to encourage private sector workers to get vaccinated, first of all, can you say or share with us what percentage of your members are opposed or unopposed to this move?
Well, the last survey we did, Richie B, showed that 30% of our members were willing to take the vaccine, our employees. Another 30% were uncertain, and the remainder had said no. So if we look at those figures, we would be able to reach at least 60% of the workforce. Mm-hmm. But as you know, with the new mutations, and we had a herd immunity figure of 65% set for next year, March, those figures have been moving, and we know that we need to at least reach 80 to 90% of our population.
And you say that with a lot of confidence. And within what time frame are you hoping that that will be achieved?
Well, Richie B, at the rate we're going, it looks like it will take us years. And that's why we have come out with this position that the time is now for workplace vaccination policies. Because as you know, we have around approximately 300,000 persons in Jamaica that have been vaccinated. That is less than 10% of the population. And if we want to get to herd immunity at 65, even just to 65%, that is going to take us a very long time. And you would see that even the government themselves have now adjusted the numbers that they want to do in the coming months. So we're at a place right now where we believe that we have reached a roadblock where there's high hesitancy, and we have to go where we need those mandates. And we're also encouraging the government and would support the government to use their powers as well to introduce incremental requirements for vaccination to protect the public.
All right, Imega, we're now joined by the president of the JMEA, Mr. John Mahfood. Good morning, Mr. Mahfood.
Morning, and morning, Imega.
Good morning, John.
Thank you for joining us, John. We're just talking with Imega. You might have heard the tail end of that point she was making. I wanted to ask you, though, John, why do you support the matter of mandatory workplace vaccination?
What we have found, at least with our members, who have about 80,000 employees, is there was a lot of inconsistency in their application of the vaccination. So we wanted to guide them on what they needed to do and the process in which they needed to do it. Some companies, for instance, just arbitrarily said, you have to be vaccinated or do a regular testing. Some went through the process of instructions, advice, consultation, and so on. So that was the first issue that we wanted to do, is give them advice on the best way forward. So it's fair to the employees and fair to the company, and ultimately to get to a reasonable level of vaccinations. And of course, with the private sector vaccination initiative, where we can send our employees to the Girl Guide Center we are able to we are able to get the vaccinations done, and a number of companies in the private sector have gotten to 70 or 80 or 90% vaccination rate. And finally, we realize too the how difficult it is even for individual companies to convince and cajole their employees. So we realize too how difficult it is going to be to do it on a national level, and feel that the government needs to step up, needs to do more, including having more vaccination sites and better communication.
Okay.
But ultimately, we have to get to that stage, as Imega said, in order to protect the people of Jamaica.
And so looking down the line then, John Mahfood, what will happen to those who work in the private sector and are not willing to take the vaccine?
I think ultimately, if their decision is not to take the vaccine, then they will have to be separated. The companies will have to separate from them.
Mm-hmm.
But just want to add there, Richie B, that there are options as well. So dismissal is something that we're saying is the last resort. So after you do the consultations with the members, there might be alternatives if people can work from home. And also you would have seen that in those policies that are being developed, it asks for periodic testing, antigen tests or PCR tests to be provided to the employers.
To the employers?
Yes, that's correct. So you would see that you ask for interval testing to be able to enter into the workplace to show that you are negative on a regular basis.
Well, because I asked that because I know there's a talk that in some instances the employees would have had to prove that they are COVID-free at their own expense.
Well, that one is still up for legal debate. We know that some companies have said yes at their own expense, and we know that there are companies also that have been paying for these tests from the onset of the COVID pandemic. We know that it is costly, and one of the other things that the three associations are actually working on is how we can make testing more affordable, not just for employees, but everyone in Jamaica, so that we can know our status.
Okay. John, no doubt conversations are being held between your association and the government of Jamaica. Would you say this morning that the government is receptive to the suggestion coming from the private sector bodies in relation to mandatory vaccination?
Well, as far as the JME is concerned, we haven't had discussions with the government about mandatory vaccinations. What we have been asking the government to do is to do a better implementation program for vaccinations and to significantly expand the number of sites that are available to people. Instead of just the government sites and a few private sector sites, it needs to be opened up dramatically to doctors, to healthcare centers, to pharmacies, and so on. It does mean that there has to be change in legislation to allow it, but my own feeling is that if they continue with the limited sites that they have, we won't get to the point where we want to get.
Mm-hmm. Imega, there's a lot of concern about the quality of vaccines we currently have, and there are other concerns of a similar nature. How does the private sector plan to assist maybe in getting additional vaccines into the country?
Well, the private sector has been playing that role from the onset. It's the NHS role, and I know Howard Mitchell is very active in that, and he's out and about trying to get vaccines for us. But as we know, Richie B, vaccines are available currently. I think we have a stock of 500,000 doses, and we actually see where we're at risk at disposing some of those because of the level of hesitancy. So what we're trying to say to people is that the best vaccine is a vaccine that is available to you right now, and we want to get the economy going back up. We want to get the people back out. So the best way to do that and the quickest way to do that is to get vaccinated.
And John, can I get a response from you in terms of those persons who would say mandatory vaccination is illegal? No doubt you'd have looked through this matter carefully. What is your response to that?
before I answer that, I just mentioned to you, Richie B, that in the U.S., the AstraZeneca has not been introduced, and so most Jamaicans living abroad know about Pfizer and the others.
Yes.
So that's the one when they coach and advise their relatives in Jamaica. That's the natural one that they advise is Pfizer because that's the most popular one in the U.S. And so I think that's possibly why we're having this debate about which is preferable. So the other issue is that in terms of legality,
yes,
we have done our work, our research, and we have been advised that if you go through a process, Richie B, of talking, of consulting, of looking for alternatives, you go through a whole process with each employee so that you can explore the whole area. And at the end of the day, if employees can't be placed elsewhere, if they have medical advice that says they shouldn't take it, so and so, at the end of the day, if there are a few employees who say just for their own personal reasons, they don't want to do it, then we have to separate, and we believe we have legal position to do so.
Okay. The matter of anti-vaxxers, Imega, no doubt within the private sector, you're all thinking of ways that you can maybe, try to convince them or other action will have to be taken, eh?
Yes, we've been trying moral suasion. The private sector has been out there. You see our government officials out there. Yet we're seeing that on a daily basis, the number of persons getting vaccinated is lower. So I think we're at that stage, Richie B, where we will have to think of other measures. And one of those we're saying is for the government to actually look at incremental requirements for vaccination to protect the public, and from a private sector standpoint, for us to start establishing vaccination policies in the workplace.
Are you expecting positive outcomes from the government perspective?
Well, if I have to go by media reports, I see that the Prime Minister has been hinting to it. We, as John has mentioned, we have not had any discussions with the government around it, but the Prime Minister did allude to the fact earlier that if moral suasion is not working and they go out into their constituency and they don't see that the numbers are improving, then at some point vaccination mandates might be necessary.
John Mahfood, in closing, would you agree with the sentiment that the private sector groupings are pressuring the government into making this move?
No, what I would say to you, Richie B, is that in every other country, it's the government that leads the process, that takes decisive action. You see it happening in Australia and elsewhere, where the government steps up and talks to the people and lets them know what is best. And that is how it should be. In Jamaica, unfortunately, because the government right now is hesitant themselves in knowing what to do and what leadership position, the private sector is the one that is coming to the front and talking to the people. And unfortunately, when it happens that way, there is a lot of thought in the general population that we are only doing it for our own purpose. It's only about business and not about people's welfare. And that is very unfortunate because it is not about economy for individual companies. It's because we care to see that children go back to school, that poor people are able to get jobs, and that because the government is not able to afford to support the poor in Jamaica. So we are anxious and very angry that the government is not taking a leadership role and not doing a better job. That is my position anyway, personally.
Okay, I hear you loud and clear. We're at a critical stage, and we thank you for accommodating the discussion this morning, Imega Breese McNab and John Mahfood. I wish you both a wonderful day. Thank you so much.
Thank you, Richie B. Same to you.
Thank you. Bye-bye. All right, we chatted there with Imega Breese McNab, the Executive Director at the Private Sector Organization of Jamaica, and we also had conversations with John Mahfood, who is the President of the Jamaica Manufacturers and Exporters Association. Hope you found that to be interesting. Like I said before, we're at a critical stage, and a lot is ahead of us. We'll see how it all pans out. It's 14 now before the hour of 8 o'clock. And we're pleased to be joined at this time by the CEO, Miss Julian Dixon, who is our guest on the telephone. Good morning, Miss Dixon.
Good morning, Richie B. How are you?
I'm doing well. Thank you so much for coming on board with us this morning so we can let the Jamaica and the world know more about your company. First of all, Julian, tell us a little bit about Sotheby's International Realty Jamaica for those who may be listening but not quite familiar with the name of this company.
Right. So Sotheby's is actually a lifestyle brand. It started as an auction house, and then they started a realty arm in order to help the needs of their clientele, their opulent clientele.
Mm-hmm.
And now they're in Jamaica to do the same. I mean, for years, we have not had great representation for luxury here on the island.
So the focus obviously is on luxury, as you mentioned, right? Why in particular, though, at this time did you decide to bring this franchise to Jamaica?
Well, it has always been a dream of mine. Early in my career as a realtor, it has always been my training ground. So I'd always visit their website, and I always look at their description, the photos, and that was my training ground. Mm-hmm. And to be able to do this, I'm not only happy for what the company will do, but I'm happy for what it will do for its brand in Jamaica.
Julian, do you see then that there was a need for this kind of service that you obviously are specializing in, and you know, in the the realty business?
There is an absolute need. Mm-hmm. For years, agents like myself, the challenge that we faced is always about representing our clients the best way that we can. And not having the tools that are needed was a strain. So the biz have really curated and understands what needs to be done. Mm-hmm. And as such, it is definitely a need. A lot of people will misunderstand what luxury means. For us, it is not a thing. It is not tangible. It is more so affiliated with a feeling and service. Mm-hmm. And that is what we'll offer.
Which areas will Sotheby's be servicing?
Wherever there is a need and that we're able to satisfy that need. If we are not able to satisfy that need, we're happy to refer the business to somebody that specializes in that area. Mm-hmm, mm-hmm.
And is the plan to cover like all types of real estate, or is it mostly residential?
Again, wherever there's a need that we can satisfy.
So that could mean even commercial, for that matter.
I think so.
Let me indulge you a little bit more, Julian. In and around Kingston, there are many developments that are going up. Construction, it would seem, is booming. But how much do you think the real estate market is growing by approximately at this time?
Well, I believe that Jamaica is in a development phase. I see it as a good thing because we are underdeveloped. We need more in infrastructure. We need more in our residential and commercial real estate. And not just in Kingston, but island-wide. Mm-hmm. I mean, right now, as it is, Sotheby's just got a listing in Trelawney, in Coral Springs, 360 acres of untouched land on the beach. Mm-hmm. And for us to have that available in such a prime location, it just shows how much more development is needed in Jamaica.
Mm-hmm. Are you getting traction in that particular listing?
Well, we are just live today.
Okay. So
today is our launch day.
Oh, really? Okay.
This is the first conversation I'm having publicly about Sotheby's.
We feel very, very special, and we really want to take time to congratulate you. You're launching today.
Yes, we are.
Yes. Where are you going to be located? And while we're at it, how can you be reached?
We will be located at 144 Constant Spring Road, that's Super Valley Town Center. We have one of the best offices in the island. I'm so proud of it. A place where agents will find comfortable and ease to work, and clients alike will be happy to come in.
Okay.
We can be reached by our website and or phone number, and of course social media and so on.
All right. Sotheby's is what it is. Sotheby's International Realty, Jamaica.
So we are Jamaica Sotheby's International Realty. Yeah.
Oh, okay. Thank you. Got you. Now, let me ask you now, Julian, with the COVID pandemic and all that's going on, how has this affected the real estate business, even up to this point, from your perspective?
Well, the real estate industry worldwide, not just in Jamaica, has grown. It has done immaculately well. And it just goes to prove that when there is economic uncertainty, the best thing to invest in is earth itself.
So you see still being buoyant going well into the future?
I am optimistic.
All right. All right. I want to take time to congratulate you again and wish you and all the members of your team. No doubt your team is being built out and will get even bigger as time progresses. I want to wish you all the best. Good luck with that property in Trelawney, 360 acres. It would be nice if you called us back to say, hey, you know what, Richie? Immediately after I spoke to you, I got a call. It seems like I have a buyer for that property.
I will call you because that will happen.
Absolutely. Good luck with that.
Thank you so much, and have a great rest of your day.
All right. Much appreciated, Julian. Great talking with you. Thank you so much, Stu, and good luck.
Take care. Bye-bye.
All right. Bye-bye. That was a chat with very forward-thinking, beautiful lady by the name of Julian Dixon, the CEO at Sotheby's International Realty Jamaica. And they're launching today. She says it was her first public conversation, and she chose The Bridge, 99 FM, to have it. Now you know she's in the business. Make the time now 8:31. My apologies, I'm 1 minute late with the start of this giveaway, but don't worry, you still have your opportunity. We'll put back another minute on it if we have to, but right now, ladies and gentlemen, it's a Friday morning. What day is it? The 8th day in the month of October, and it's a historic day because whereas we started telling you about giving away $99 US, my boss called and said, hey, Richie, it's a Friday, man. I want to make somebody feel good today. I want somebody to win double that money, so I'm just putting an extra $99 right here on Bridge 99 FM. So it's 2 times $99 US and 4 times $99 Jamaican that we have in the jackpot. You can do the math. We got some callers, and so, ladies and gentlemen, if you call in 876-676-4996, you'll get an opportunity to win all of this money. It's the only game of its kind in the region, giving away 2 types of currency. It's a dual currency giveaway, US and Jamaican dollars. Let's get the sound right now so you can know what you must identify. What is that sound that you just heard? 876-676-4996. Good morning. You're on the air.
Hello. Good morning.
Good morning. How are you?
I'm fine. Thank you, Richie.
Okay. Who's calling?
Angela from Portland Cottage.
Angela.
Yes, Richie.
What's up, Angela?
I'm good with me.
It's been a long time.
Very long time, Richie.
You are one of my original support. I'm not even going to call you a fan. You're my supporter. You have supported me through many decades in the music and entertainment industry, and I'm really happy to hear from you this morning. Did you have a birthday recently?
On Monday?
Yes, because what's her name from who was it? Who was it?
Opal.
Opal sent me.
Right.
Yeah, I just remember now. That's right. Did you have a good day?
Yes, I did.
All right. Angela, I know that you have a history of winning, but let's see what you do this morning. Please identify the sound that you just heard for winnings in the Secret Sound game.
Well, I'm thinking, Richie, it sounds to me like a tree being cut down.
A tree being cut down.
Yeah.
A tree being cut down.
Yes,
That is an
Richie.
interesting one. Like a tree being cut down. DJ Hardley. Is it a tree being cut? Listen to the sound again and make up your mind as to whether it. You mean you're talking about the saw making the sound cutting the tree?
Yes, Richie.
Hold on, listen again. Angela, you've heard the sound again. Give me your final answer.
It sounds like a saw cutting down a tree, Richie.
Angela from Portland Cottage. Whew. Yo. You know that you're going after not $99 as I thought it would have been, but my boss called me and says double the US dollars to $99 times 2. You know you're going after $198, right?
Yes, Richie.
And 4 times $99 Jamaican because we've been climbing by $99 Jamaican every day. Well, guess what? You're not right, Angela, I have to tell you, but you are definitely thinking. You are thinking. I'm just going to leave it at that. Thank you. Have a good day. Really nice hearing from you. Wow. Let me go to another call. 876-676-4996. You heard what she said, DJ Audley.
Loud and clear.
Loud and clear. Let's get another call up in here right now. It's not $99 US as I thought it would have been. My boss called me and says double that money for my listeners. What's wrong with you, Richie? And so I'm doubling it to $198 US dollars plus 4 times $99 Jamaican. All of that money. Do the math and see how much money you can win right now. Good morning. You're on the air. Welcome to the Secret Sound Game. How you doing?
Good morning. I'm good.
Okay, who's calling?
Rodok. Come on to the studio. Hey, Rodok.
You said what? Word up?
Rodok.
Oh, Rodok.
Yeah.
All right, where are you calling from, Mr. Rodok?
Kingston.
All right, would that be Kingston 6, Kingston 13, Kingston 11, Kingston 8? Where?
Kingston 5.
Kingston 5. That means you're not too far away from where we are. All right, so Rodok, they call you Ruddy?
Yeah.
Okay, Ruddy. You've thought about the sound. You've heard it. I'm going to play it one more time so you can make up your mind finally. And then you give me your final answer. Let's go. Listen this. All right, so we're going at... He got cut off? How come? Ruddy. Rudolph. Ruddock. Oh, come on. Call us back. What's wrong with you? You got to get some credit before you call us, man. That's him? Okay, another caller. My goodness, he Mr. Stern. Good morning. You're on the air. Hello.
Morning.
Morning, sir. Who's calling?
Ellis from Kingston.
Ellis from Kingston?
Yeah.
All right. Okay, Ellis. Good to hear you, man. Thank you for listening to The Bridge, 99 FM. And you get a chance to win multiples of $99 in US dollars currency. For instance, you're getting 2 times $99 US and 4 times $99 Jamaican because it's a dual currency money giveaway in the Secret Sound. You've heard the sound several times, right?
Right.
Have you made up your mind as to what sound it is?
So like a chainsaw starting up.
It sounds like what?
A chainsaw starting up.
Like a chainsaw starting up?
Yeah, like when you're starting a chainsaw.
Hold on. Ellis, hold on. You can change your mind if you wanna, or you can stick with it if you wanna. If you're going in for this $99 times 2 US dollars and 4 times $99 Jamaican on Bridge 99 FM. What's your final answer, Ellis?
I'm gonna stick with the chainsaw starting up.
Ellis! You are wrong, my brother, man, but thanks for trying. Whew, that was,
all right.
Oh, boy. All right. All right. Oh, gosh. I don't know, boy. By the way, if we don't have a winner today, it's not like the boss just said, double it today and then remove that extra $99 from Monday. I said to him, so do you mean that if we don't have a winner today, I can go forward into Monday with $198, which is $99 times 2 US? He says, of course. So here we go. Good morning. You're on the air. Hello.
Hey, good morning.
Good morning, sir. How are you?
I well want the money, man.
Well, you must work for it, brother.
I'm working because my work already have one put me have one place me sit down.
So the money ought to do you well, though.
I believe so.
Yeah, you're talking about 99 times 2. That sound like about $198 US, brother.
I would be so thankful at this time.
Yeah, man. And then now when you look at the fact that it's a dual currency giveaway, so you have 4 times $99. In other words, if there's no winner today, and we have to move to Monday, we're going to add another $99 Jamaican. But for today, it's also 198 US. And then 4 times $99 Jamaican because nobody has won since Monday. So you're talking about $396 Jamaican in addition to the 2 times 99, $198 US. What's your name and where are you calling from?
I'm Lincoln Thomas from Clarendon.
All right, Lincoln. Listen, man, he says he has 1 foot and he's not able to move around well. Listen, if it was left up to me, man, I'd just say, Lincoln, hold a piece of food here. But guess what? It's a game and we've got to do it the right way. So, listen to the sound, Lincoln.
You don't have to play this song again.
I don't have to play it again. Lincoln is ready to go. Let's hear your answer, Lincoln. What is it?
The answer is 2 trees crushing together.
You think it is 2 trees?
It's not thinking. I know it's 2 trees rubbing together.
You say it is 2 trees rubbing together. Lincoln.
Yes.
You have thought about it long and hard. I give you 5 seconds to change or to stick with that answer. What is your final answer?
There's no changing.
Your answer is?
2 trees or the limb and the tree rubbing together.
Oh my goodness. Let me tell you something. The zone is not bad, but the answer is not right, Lincoln. I'm so sorry. Okay. Thank you for trying. You get a chance to try on Monday, though. And we'll still have, at the start, $198 US, which is 2 times $99, as my boss instructed me to double it to $198 today US. And we'll add another $99 for Monday in terms of Jamaican currency. So you'll have 5 times $99 Jamaican and 2 times $99 US in the secret sound game. Think about it one more time. This is the sound that you must identify come Monday morning at 8:30. Identify that sound and be in the runnings, be in the winnings right here on Up and Go. You guys would have noticed that Itana, as we mentioned yesterday, she came out and she spoke about some incidents years ago where a producer invited her to see his new studio, and on her exit, he pulled up and basically grabbed her and kissed her. And he never did it again, she says, because he saw her reaction. Not long ago, somebody just sent me a message from, well, in fact, not a message, but a post from Diana King under the heading, Diana King shows solidarity to Tanya Stephens. And Diana King, in a show of solidarity to Tanya Stephens, pointed out that most of the men she encountered while she was pursuing her music career in Jamaica, except for a few whose friendship she treasures to this day, have tried to forcibly have sex with her. King, who has in the past declared that she too has been a victim of rape, was agreeing with Tanya Stephens that she should not reveal the name of the artist. And somebody also mentioned to me this morning that did you hear this one? Jada Kingdom apparently had said that she was Jada Kingdom. Apparently, based on what one of our listeners, who is always in the know, says, is pointing out that Jada Kingdom said she was raped twice in 1 month. Yeah, you heard that? You heard that? I didn't hear that one before. Jada Kingdom, you heard that one? No.
No.
Okay.
No.
No. I mean, I'm smiling because you seem so shocked that he couldn't even get the words out, the word out, you know. Here's another one that we're just picking up. I think I've heard this one, though. I think Lady Saw actually came out, Marion Hall. Yeah, she also came out and said that she was raped I think lady said she was raped multiple times, and eventually she thought it might even have affected her fertility. So, ladies have been going through a lot.
Richie B, the party master, on Up and Go, The Bridge, 99 FM.